How soon can you walk after a tummy tuck surgery? Have you ever wondered how soon you can start walking after a tummy tuck surgery? This is a common concern for many patients. After a tummy tuck, which is also known as abdominoplasty, patients are generally encouraged to begin walking very gently within 1 to 2 days after the procedure. This early movement is crucial for promoting circulation, reducing the risk of blood clots, and supporting overall recovery. However, it is essential to walk slowly and cautiously to avoid straining the abdominal muscles or the surgical sites. In the first couple of days, patients usually start with very light, assisted walking around their home. This helps with circulation and prevents complications such as deep vein thrombosis. During this initial phase, movement is limited to essential activities, and patients are advised to avoid standing fully upright to reduce tension on the incision. As patients progress into the first week, walking continues but remains light and limited. It is common to experience swelling, bruising, and discomfort, so activities are carefully controlled. If drain tubes are placed, they typically remain in place during this phase. By the second week, drain tubes are often removed, and patients may notice that swelling begins to subside. At this point, they can increase the frequency and distance of their walking, but it is still important to avoid lifting heavy objects or engaging in strenuous activities. Between weeks 3 and 4, mobility improves significantly. Patients can resume more normal daily activities, including desk work. During this time, compression garments help support healing and reduce swelling. As patients move into weeks 5 and 6, they may begin light cardiovascular exercise, but only with the approval of their surgeon. Walking becomes more comfortable and less restricted during this period. By weeks 7 and 8, most patients can return to near normal activity levels, including moderate exercise. However, high-impact activities should still be avoided until they receive full clearance from their surgeon. It is important to remember that while walking is encouraged early on, strenuous activities, heavy lifting, or intense exercise should be avoided for at least 6 to 8 weeks. This allows for proper healing of the abdominal muscles and skin. Walking helps maintain circulation and aids recovery, but it must be balanced with protecting the surgical site from stress. Patients should always follow their plastic surgeon's specific post-operative instructions tailored to their individual case. The timeline for walking can vary based on the extent of the tummy tuck, whether it is combined with other procedures, and the patient's overall health. In summary, gentle walking can usually start within 1 to 2 days after tummy tuck surgery. Gradually, walking can increase over the following weeks, with a full return to normal activities typically by 4 to 6 weeks and more intense exercise after 6 to 8 weeks under medical guidance. This staged approach optimizes healing, minimizes complications, and supports the best aesthetic and functional outcomes.